How often do we pause to consider the lasting impact of the foster care system on the children it serves? In the heart of Philadelphia, we find Micaiah, a 17-year-old girl who, like thousands of youths, experienced the harsh reality of homelessness before being absorbed into the foster care system. Her tale is one of resilience amidst instability and trauma, a narrative far too common among foster children. Indeed, an alarming statistic reveals that 1 in 4 children who age out of foster care find themselves without a roof over their heads within 4 years. The constant shuffling between homes in the foster care system has severe, often unseen consequences. But what happens when these children age out of the system, when they're expected to navigate adulthood without a safety net? The struggle is real and daunting. Let's consider Micaiah, a 17-year-old from Philadelphia who escaped the clutches of sexual violence and unstable housing, only to find herself homeless after exiting the foster care system. This is a narrative far too common. 1 in 4 youth who age out of foster care become unhoused within 4 years. Then there's Benjamin Zander, a transgender teen from Oregon who, after multiple foster placements, ended up in a facility that resembled a jail. This resulted in severe mental health issues and a feeling of utter isolation. And let's not forget the Afghan children who fled to the US for safety, only to find themselves trapped in regimented facilities, their mental health deteriorating with each passing day. The constant shuffling between homes, the traumatic experiences, the lack of stability, all these factors lead to a higher likelihood of these young adults facing arrest, homelessness, unemployment, and early parenthood. As they step into adulthood, many of these children find themselves falling through the cracks. So, what can we do to support these children, to ensure they have the resources they need to thrive? We can start by acknowledging the need for comprehensive reform. The foster care system, as it stands, is not wholly equipped to handle the diverse needs of all its wards. The lawsuit in Oregon, led by Benjamin Zander, is a prime example of this. It's the first of its kind, addressing the rights and specific issues faced by LGBTQ youth in foster care, who are at a higher risk of harm within the system. We also need to improve our data gathering. The lack of complete data on LGBTQ youth in foster care in Oregon is a glaring oversight. Accurate data is essential for understanding the scope of the problem and tailoring solutions accordingly. Lastly, we must increase support for other vulnerable groups within the foster care system. The plight of Afghan children in US government custody is a stark reminder of this. These children, who sought security and freedom, are instead facing trauma and inadequate care, with limited education opportunities and deteriorating mental health. It's a daunting task, but one we cannot afford to ignore. Because every child, regardless of the circumstances of their birth or upbringing, deserves a chance to succeed.